What's up guys, Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to talk about a simple way to use a power band like this to get some hip mobility, okay? So as you may or may not know, the hip is a ball and socket joint, okay? So we have your socket, which is the pelvis, and then the ball fits into there, and that's the head of your femur, okay? So that long bone in the thigh. And when we do things like squatting or deadlifting, we need to make sure that that ball and socket joint is moving really well, okay? So obviously there's muscle flexibility that plays into being able to do a quality deep squat or deadlift effectively. But if that joint is stuck, and that joint isn't what we call a roll and glide, okay? So we need that ball and socket to roll and glide with each other, and it can't be stuck, it can't be causing any sort of impingement or anything like that. We need to make sure that we unlock that so that we can get to better flexibility points, deeper squat, better deadlift, and then that essentially leads to better strength. So mobility, having better mobility leads to the ability to strengthen in deeper ranges and strengthen more effectively. So we're going to talk about a way to do like a lateral distraction and a posterior lateral distraction to get a little more mobility in that ball and socket joint so that when you go into those deeper ranges of your squat, you're better able to get there without any sort of pinching in the front of the hip or any pain or anything like that. So we'll get right into it. All right, so like I said, you're gonna need a power band and something pretty sturdy to tie it to. So this isn't necessarily something you can do at home. You're gonna need to do this when you're at the gym, unless you have something in the garage or something that's pretty sturdy bolted into the wall. So you're gonna get a thick band and then get something soft to kneel on, okay? Even if it's a towel roll or something, anything so you protect your knee because you're gonna be loading through the kneecap and you don't wanna cause any knee issues while you're trying to fix your hip, right? Let's fix one problem at a time. So what you're gonna do is you're gonna step into that band and get it pretty high up, basically as high up as you can get it into your groin, okay? From there, I'm gonna get on hands and knees. I'm gonna put the side that I'm trying to mobilize, the hip that I'm trying to mobilize, that's where I'm gonna place that pad, okay? And I'm on my hands and knees, I'm gonna slide this leg straight back, okay? And then what I'm gonna do there is I'm gonna rotate this leg in, okay? So if you can see from this angle, I'm rotating in a little bit, and that band is pulling the ball of my ball and socket joint laterally or outward, okay? And it's kind of just creating a distraction point. So from there, what I'm gonna do is I'm going to shift back, and I'll show you at another angle in a second so you can see a little bit better. So that angle's kind of coming, you can do it a couple ways. You can go straight out, or you can go a little bit in that 45-degree posterior angle, meaning not straight out, but a little bit towards the back, okay? So posterior lateral, as we call it. And what I'm gonna do there is I'm going to sink back in it a little bit and then kind of rotate the opposite pelvis downward and shift my hip out, okay? And now I'm losing a little tension, so I'll just come out and do the same thing. So a little better angle here. So I'm foot in, I'm dropping that pelvis, I'm shifting out, I'm leaning back, and you're gonna feel a stretch deep in that glute muscle, okay? What that's doing is it's distracting that joint. You're getting a little bit of a stretch of some really tight muscles, and you're feeling what's called the capsule, which is around the joint. You're feeling a capsule stretch, okay? So what you wanna do here is hang out for a good amount of time, okay? At least a minute, if not 2 minutes, or at least work your way up to that and really start to feel that mobility. And when we're done with that, kind of test out your squat and feel if you can get a little bit deeper. See how much you've gained in terms of mobility and how much it's helped your squat, okay? So let me show you another angle just so you can get a better view. All right, guys, so just like we said before, I'm on my hands and knees. I got that soft pad underneath my knee here. This other leg is gonna go back. I'm gonna rotate this foot inward, kind of like a pigeon stretch, if you know what that is. And then I'm gonna sit back. I'm sitting back. I'm already feeling a little bit of a stretch in the glute. I'm gonna rotate that opposite pelvis downward a little bit, and then this kind of shifts out. And if you lose tension when you create that shift, pull it back out and reset. There's gotta be a decent amount of tension going through there so that you actually mobilize the joint. Okay, so back, rotate, shift out, and I feel that stretch right deep in the middle of the glute there, okay? And like I said, hang out for a minute, if not two, and build up to 2 minutes, and really get that elongated stretch to start to stretch out some tissues deep in there, okay? Like I said, retest, so squat before you do this, and then squat again after, and see if you're able to get deeper, or at least if it feels a little bit better, especially if that hip was already giving you trouble in the bottom of that squat, okay? Do both sides if you're having some general mobility issues, and then just keep doing it continuously, and over time you're gonna see a big difference, all right? Until next time, Dr. Greg, I'll see you guys.